Welcome to Nursing Safety, June 2012. This safety program will cover where most injuries in nursing occur, how to deal with ergonomic issues, how to deal with blood-borne pathogens, patient violence, where to get help on the internet, and what nursing injuries statistics show. Part 1, Nursing Accident Statistics. The U.S. Department of Labor states that working in a nursing environment is the second most dangerous job outside of construction trades. Injuries which participants will get are muscular skeletal disorders, exposures to blood-borne pathogens, and patient-related injuries such as workplace violence. Back pain affects 38% of all nurses. Working injuries cost employers an estimated $1 billion a year. The nursing home industry is an OSHA-targeted industry for training and inspections. That means it gets in the top 10 hit list virtually every year. Types of injuries which are very commonplace in nursing situations: muscular skeletal disorders, as we stated, workplace violence, and of course exposure to blood-borne pathogens, all of which will recommend methods of controlling these hazards. The goals of nursing safety will be to teach employees to recognize the signs and symptoms that musculoskeletal disorders present, so they can report them early and respond to them appropriately. Nurses should be able to identify jobs and tasks that have caused ergonomic stresses and are capable of musculoskeletal disorders. Knowing how to control the ergonomic stressors depends a great extent on the effectiveness of ergonomic training. This program will explore back pain and its causes, safe patient handling, alternative methods of patient handling, workplace and engineering controls. Nursing back pain has several causes: genetic causes, age-related, physical capabilities, your general health, psychological factors, and job dissatisfaction. Unsafe lifting practices account for the majority of back injuries. Most injuries occur as the result of twisting and turning while bearing a load. Unassisted lifting accounts for over 1/2 of neck, back, and shoulder injuries. Musculoskeletal disorders occur while guiding or slowing, falls, engaging in an activity of resident handling, and need a method for guiding and slowing the falls. Slide 14. When a resident is falling, remember that the use or transfer of gait belts may assist the caregiver in guiding the fall. Hold on to the belt handles and slowly lower the resident to the floor using correct body mechanics. Review resident assessments and watching for signs of weakness are effective ways of preventing falls. Keep your back straight. Tighten your abdominal muscles, bend your legs, and stay close to the resident, if it is safe to do so. Do not attempt to stop the fall abruptly, as this may contribute to a caregiver injury. When using toiletry, partially weight-bearing residents who can sit up unaided and use your upper extremities and have upper body strength are able to bend your hips, knees, and ankles and are cooperative. Independent residents can use these devices. Remember, risers decrease the distance and amount of effort required to lower and raise residents. Grab bars, height-adjustable legs add safety and versatility to the device. Ensure the device is stable and can accommodate residents' weight and size. When the resident is not ambulatory, remember, the use of transfer requires the employees to be trained on the specific lift device to be used and the use of an assistant. Lift devices must be kept in good working order and checked thoroughly before each use. Make sure the patient understands their role and what to do before this lift device is utilized. Topic 3, blood-borne pathogens and nursing injury prevention. Each year there are 800,000 needlestick injuries which occur in the United States from nursing assistant situations. 16,000 estimated healthcare workers contact HIV as a result of the exposure in these incidents. HBV and HCV pose a greater risk than HIV. Here we can see that almost 50% of all blood-borne pathogen injuries occur in the nursing profession. Blood-borne pathogen injuries occur in situations where the majority of healthcare workers are disposing of needles, administering injections, drawing blood, recapping needles, or handling trash and dirty linens. Here we can see that 70% of all blood-borne pathogen injuries occur after or before disposal activities. Only 20% occur before or during use of needles, and 10% occur during and after disposal situations. Topic 4. Patient violence and nursing safety. Common causes of workplace violence are drugs and substance abuse, psychological reasons, stress of aging, a breakdown in the communication system, and criminal intent. There are 3 types of workplace violence situations: immediate confrontations, distance attacks, and verbal abuse. Tools to prevent these incidents are as follows: a workplace violence policy by management, employee awareness programs, employee training in crisis intervention techniques. Preventing physical violence comes from erecting physical barriers and having a security presence. Patient aggression situations are when the customer, the patient, or the client are interacting, the family member or significant other shows, a current or former employee, manager, or supervisor is interacting with the individual, or a stranger on stranger situation.